Did you know that in any given year, 1 in 10 people consider switching doctors because they're unsatisfied with the care and communication they've received? The good news is that there are steps you can take to re-engage current patients and attract new ones. This is where patient outreach comes in. Patient outreach consists of reaching out to existing and potential patients as a way to bring them to or back to your medical practice. Plus, the hospital sector has become an extremely competitive market, which offers patients more options than ever before. Today, we'll be looking at 4 ways that you can optimize your patient outreach efforts and continue to sustain and grow your practice. I'm Noel with Jotform. Let's go. First, you'll want to personalize your communication with patients. Provide patients with tailored messages surrounding their specific needs and where they are in their healthcare journey. According to 2019 data, patients are up to 35% more likely to respond to requests for feedback sent via text messages as opposed to an email or phone call. With automated patient outreach through text messages, practices are better able to communicate these messages at scale while using specific segmented population findings to make sure that their entire patient population is covered. You're also able to send patients reminders regarding important screenings, upcoming vaccinations, wellness visits, and other preventative care that is vital to continued health. You can even personalize messages for certain conditions. For instance, a specific patient outreach effort could focus on adults between the ages of 45 and 70 who are at a higher risk for hypertension. These personalized text messages can prompt them to schedule a health screening or check-in visit. Second, make sure that you effectively manage your referrals. Optimizing referrals is one of the most effective yet underused methods of patient outreach, and it's vital that you manage them proactively. One study reveals that 33% of patients who've been referred to a specialist never attempt to make contact with that doctor's office. 40% of the patients who do make an appointment don't provide their referring physician with any information from that visit. This means that it's up to the medical practice to effectively manage these referrals. This requires developing staff rules, workflows, and information systems to both track and manage all patient inquiries. It's crucial that you support these patients by giving them the information and care that they need. This can include scheduling services or tracking progress and results. Third, invest in outreach staff. Medical practices tend to push patient outreach to the bottom of their to-do list, but it's important to communicate with your patients throughout their health journey. In fact, 53% of patients say that exceptional customer service is important to them when it comes to healthcare providers. And good customer service includes reaching out when they're not in your office. It's a good idea for you to hire a patient outreach staff that focuses on communicating with current patients to ensure that their needs are being met. This can be done with personalized emails, text messages, and community outreach events. Your patients will not only feel valued, but their health outcomes will be better. This can also result in you having additional referrals and fewer missed appointments. Fourth, leverage technology and online forums. Medical practices now have the tools available to reach out to patients in a wide variety of ways, one of which is through online forums. Figure out how your patients feel about your medical practice. Is there a reason they are not responding to your patient outreach? Even though 75% of providers say the patient experience is critical to the future success of their organizations, an overwhelming number of patients are not happy with the care they're receiving. This is why it's so important to utilize patient satisfaction surveys. With patient satisfaction surveys, your patients are able to rate their level of care, including everything from wait times to follow-up correspondence. They're able to give providers a clear picture as to how they can improve their operations in the future. Practices can also improve their patient outreach by monitoring things like automated dashboards, opt-out rates, and response rates. This data can help to improve message content and outreach efforts, and can help practices create a new strategy to increase engagement. Let's review. Patient outreach is vital to the success of any medical practice. We looked at several steps to help you improve your patient outreach strategy. Make sure that you personalize your communication with your patients. Manage your patient referrals so that they actually take advantage of the referral and get the proper care. Hire an outreach staff whose entire focus is patient outreach. And finally, leverage technology and online forums to get feedback from patients. When you have the right information, it'll be easy for your practice to meet the needs of your patients and even bring in new ones. Well, thanks for watching. I'm Noel, and this is Jotform. See you next time.